We all know the importance of the golden hour in the survival of the trauma patient. However, in the rural EMS setting, such factors as weather, communications, human resources, and the distance to the appropriate treatment facility can steal these precious minutes. The following program shows an EMS crew faced with many of these same challenges. Watch and analyze their performance. Pick out the factors that make them successful in their use of the golden hour and their race against time.
Sure looks like a nice day out today.
Yeah, the weatherman says there's a chance of thunder showers all day, though.
I wonder if Life Flight will be able to get up and fly today.
I'm sure glad they were the last time we used this equipment.
Station 1, signal 17, 496 Pinehurst Street.
Medic 1 to control en route.
Medic 1, signal 17, 496 Pinehurst Street. Are you familiar?
That's affirmative.
Amos must be having trouble with his diabetes again.
Last time I picked him up, he'd taken too much insulin. His blood sugar was 17.
That's not good.
I thought you knew where this place was at.
Well, the last time I was out here fishing, it was just right down here around this corner.
Well, it'll be the last time I go fishing with you.
Oh, now you don't have to act like that. We'll find it.
Hey, what was that?
Looked like a motorcycle. We better check that out.
Yeah.
Sheriff's Department, what's your emergency?
I'd like to report a motorcycle accident.
Okay, what's the location of the accident?
I'm not really sure. I'm just out in the country.
Okay, can you be more specific?
Well, we turned off Route 50 and drove for about a couple miles.
Okay. Did you see any landmarks or mileposts in the area?
Well, a while back we passed a dairy barn and I thought I saw a sign that said 329.
Okay, I think I know where you mean. We're going to respond a deputy and an ambulance in that direction. Please hold the line for a second. I'm going to get the ambulance.
Okay.
5111, motorcycle accident in the vicinity of State Route 329 near Hart's Dairy Farm. Caller upset and unfamiliar with the area. Do you copy?
Station 1, copy.
Hi, this is Mark at the Sheriff's Department. We have a motorcycle accident.
It's been a bad motorcycle accident just right up the road. The guy's hurt really bad. We're going to need an ambulance quick.
5111. Be advised, we have a code 4 motorcycle accident with injuries, New Floodwood Road, requesting squad at the scene.
Station 1, signal 15B, State Route 329.
It's a long way from here. I hope it isn't too serious.
Medic 2 to control. We're en route.
You have any pain?
Yeah, my chest and my leg.
Okay. Squad's on its way. Should be here any second now. There's only one individual involved, and he seems to be alert and responsive.
Okay, breathing okay?
Yeah, he's breathing all right. I'm an EMT.
Okay. His airway's clear?
Yeah, he's got a good airway.
Fire department's here.
You need any help?
Yes, we get the backboard and cot, please.
Okay. Okay, I think on what we're seeing here, we're going to need to get this guy on down the road. We're going to need to get a helicopter for him. Okay, we're going to need to get the helmet off so we can make sure his airway's clear. Calvin, you want to take a look at these lower extremities? You're an EMT. Have you been trained in helmet removal?
Yes.
Okay. I'm going to get the strap here. You've got his head?
Got it.
Okay. Straps off. Okay, I've got C-spine. Okay, we'll have it off in a minute here. Watch his ears.
Yes.
Okay, we've got C-spine. Okay, can you take C-spine for me? All
I
right.
got an open fracture here, the right lower leg.
Okay. Neck veins are flat. Trachea is midline. Take a look at his chest. Are you having trouble breathing?
Yeah.
Let's get some oxygen on him. Okay, got a lot of ecchymosis, injuries, crepitus. Looks like we might have a flailed section on his chest here. We're going to need something to splint that.
Left leg looks clear.
I know it hurts. Take a breath for it. Okay, another one. Another one.
Board's ready.
And another one. Okay, thank you. Get diminished breath sounds on the right side. Get some oxygen on him. Where else are you hurting?
It's my leg.
Just your leg? Anywhere else?
I feel tingling.
Can you wiggle your toes?
No.
Okay. Okay, we've got him on high flow oxygen. You got his leg there?
Leg.
Okay. Does it hurt when I press on your stomach?
No. Yeah.
Okay. The crepitus in the pelvic area here as well.
We'll pull your shoe off from you.
Abdomen is soft.
Your shoe off. Check your circulation.
Is that oxygen helping you breathe a little bit?
A little bit, not
Okay.
very much.
Does it hurt through here?
Huh?
We need to get him out of here. Are we ready to log roll?
Board's ready.
Okay, we need to get a collar on him, then we need to log roll him.
No.
Okay. Does that hurt your neck?
It hurts everything.
Okay.
When we slide in,
Just a minute here. This collar is going to keep your neck from moving.
Okay.
I know it's uncomfortable, but it'll help to protect your neck.
Over as close as we can to him.
Okay. Are we ready to log roll?
I'm ready.
Ready? On my call. On 3. 1, 2, 3.
Ow!
Your pelvis is hurting?
Ow!
Okay. Let's take a look at the back here before we get that up.
Ow!
Okay. Back looks clear.
All clear here.
All clear there. On 3. Down. 1, 2, 3.
Oh!
Okay, you'll feel better when we get you on here. There we go. Okay, we need to slide on 3. 1, 2.
For enough. His legs.
you can hand me those head blocks there. Don't strap his head until we get the rest of him strapped on.
It's on the left.
Here's the yellow.
Knees up.
We're just going to strap your arms in for right now. We'll let them loose in a few minutes, okay? How are you doing? Can you wiggle your toes?
Not very well.
Okay, can you feel? She's touching your toes. Can you feel?
No.
Okay. Wiggle your fingers for me. Right hand, left hand. Okay, very good. Thank you.
Buckles underneath the board.
Of course. You have to make sure you get still.
We have all the straps secured.
Everything's secure.
Oxygen lines are clear. Right. We're going to be moving you. You feel the board move. You're strapped on. You won't fall. Okay. Has everybody got a handle? Is everybody ready?
Ready.
Ready.
On 3, we lift. 1, 2, 3. Secure the strap. Bring the helmet. All right, you ready? On 3, 1, 2, 3. Okay, we're going to be taking you to the ambulance. How you doing? Hurt. Okay. What hurts the most?
Chest.
Your chest. Is that oxygen helping your breathing?
A little bit.
Okay. We're going to load you in the ambulance. You feel a couple of bumps here. Okay, you ready? You're down. 1, 2.
Yeah, very good. Ready? On 3, 1, 2, 3.
Sheriff Hospital, this is Medic 2. We're en route to your facility with a single patient involved in a motorcycle accident. Copy.
You guys need anything else?
Yeah, this guy's gonna need both of us in the back. Can one of your guys drive the ambulance in?
Sure, I've done it before.
No.
Patient's a 24-year-old male, has multiple systems trauma, open fracture to the lower right leg, a possible pelvic fracture, possible flailed chest. Patient is awake and oriented. We have 2 IVs of lactated ringers. We have the patient on mast for pelvic stabilization. We have him in full C-spine stabilization and have a O2 at 15 liters by oxygen. Might suggest aeromedical transport due to patient's condition. We have an ETA of 15 minutes. Do you have any questions or orders?
We're going to analyze the previous run together, paying close attention to those critical points that save the crew valuable time in assessment, treatment, and transport. We're going to review the various stages of this scenario and let you pick out those critical points. By the end of this program, you will have a better understanding of the essential elements that will lead to a successful outcome in the rural trauma emergency. Pre-planning and preparation are essential in the rural EMS setting. You should not be running back and forth to your ambulance for every item you may need during a trauma emergency. Often in the rural setting, the squad is some distance from the patient, so we strongly urge you to bag all essential equipment to save both you and the patient valuable time. Radio communication is a high priority in achieving a successful outcome. Without effective radio communication, you're handicapped in your ability to provide complete patient care. Make sure the dispatcher notifies other supporting agencies and departments at the time of your alert. It's better to cancel a responding unit than having to wait to confirm its need after your arrival at the scene. Once you arrive at the scene, your first step is to initiate a scene size-up. Take steps to protect yourself from pathogens present at the scene. Always wear exam gloves to isolate yourself from body fluids. You should also consider using masks, goggles, or even full body isolation suit if there is a risk of infection.
Okay.
Yeah, he's breathing all right. I'm an EMT.
When there are bystanders available for assistance, choose those individuals who need the least amount of explanation and training. There just isn't enough time to train a group of laypersons in the finer points of critical patient care. When sizing up the scene, you should also consider any hazardous physical elements. Some of these include oncoming traffic, smoke, hazardous or flammable materials, and downed power lines. To ensure the safety of everyone at the scene, establish a danger zone of 50 feet around your patient. If there are any apparent physical hazards, increase your danger zone to 100 feet. Designate one person to keep bystanders outside this danger zone. Next, you need to locate all the patients at the scene. There's a possibility you have more patients than you initially realized. For example, a patient could have been thrown some distance from the scene. Some of the clues that signal hidden victims include additional helmets, children's car seats, and personal belongings. Ask your patient and bystanders if they know of anyone else injured at the scene. In this case, the EMS crew looked at the position of the motorcycle's passenger foot pegs. If they had been down, there could have been another patient they hadn't found. Look around the scene. What are the mechanisms of injury? You can anticipate 90% of your patient's injuries just by understanding how the incident occurred. Use your general impression of the scene as an assessment tool. The atmosphere of the scene as you approach your patient will set the focus for your treatment procedure. This was a severe motorcycle accident, and the general impression you should have is this patient needs help immediately. Now that the scene is adequately sized up and all patients are accounted for, it's time to begin your initial assessment of the patient.
We'll have it off in a minute here.
You should look for any life-threatening injuries that need your immediate attention. If any are found, you must treat them before your assessment continues. Next, determine the mental status of your patient. Remember the acronym ABPU, ABPU, as your assessment tool. A means your patient is alert and oriented. V means your patient is responsive to verbal stimuli. P means your patient is responsive to painful stimuli. And U means your patient is unresponsive. Now it's time to check your patient's A, B, C's. Airway, breathing, and circulation. If any of the ABCs are compromised, it's time to act, and act fast. You must, for example, maintain a patent airway. Stabilize any chest wall defect. Supply high-flow oxygen. And control any excessive bleeding. Exposure is an essential part of the initial survey. Ask yourself, have I exposed every area of the patient's anatomy? You won't be able to assess most life-threatening injuries without removing clothing. Weather conditions and the patient's privacy are factors playing into this part of the assessment survey. But at some point, all areas of the patient's body must be accounted for. At this point, you need to make a status decision about your patient. If the patient has any compromise to any of the ABCs, then you have a load and go situation. Remember, you are working within the golden hour. Your goal is to spend no more than 10 minutes at the scene. When it comes to transporting a trauma patient with cervical spine compromise, there's no debate. The patient must be secured to the backboard. Time must be taken to ensure the patient is protected against further injuries, and that existing injuries are not aggravated by any undue movement or manipulation while en route to the treatment facility. Place a cervical collar on the patient prior to log rolling, doing a survey of the entire cervical area first. This area will not be visible again once the C-collar is in place. Palpate and inspect for soft tissue trauma, crepitus, position of the trachea, and jugular vein distension.
My call on 3. 1, 2, 3. Your pelvis is hurting.
As the patient is rolled up on his side, inspect for any injuries to the posterior from head to toe.
Okay, back looks clear.
At this point, the backboard is brought up to the patient, and the patient and the backboard are lowered on a uniform count.
Okay, you'll feel better when we get... There we go.
It is time to secure the patient to the backboard. A member of your team must do a survey of the pelvis and lower extremities prior to the application of the anti-shock garment, whether the garment is inflated or not. Ideally, the pants, shoes, and socks should be removed, and the area the garment covers thoroughly assessed by inspection and palpation. Pay close attention to distal pulses, movement, and sensation. Backboard straps are fastened around the patient at least 3 points. Then, the head is secured with a cervical immobilization device. Remember, control of the head and neck must be maintained by a crew member throughout this process until the cervical immobilization device is in place. The patient can now be placed on the cot and moved to the ambulance. Transport of the critical trauma patient begins as soon as the patient is loaded into the ambulance. Whenever possible, at least 2 crew members should be responsible for patient care. 1 crew member should be responsible for initiating needed treatment based on the unit's level of certification. The other crew member should be responsible for continually assessing and reassessing the patient during transport. Once inside the ambulance and transport has begun, the detailed physical exam is initiated. The crew member responsible for the detailed physical exam needs to mentally review the scene size-up, paying particular attention to the mechanisms of injury involved.
Is that oxygen helping?
Next, this person repeats the initial assessment, followed by a head-to-toe exam of the patient using the assessment tool called DCAP and BTLS. Each area of the patient is examined for deformities, contusions, abrasions, penetrations and punctures, as well as burns, tenderness, lacerations, and swelling.
Can we get pressure on him?
Next, the patient's vital signs are taken, which include pulse, respiration, blood pressure, and pulse oximetry if available.
Okay. Good. Do you remember what happened?
No, I think I might.
Okay, how old are you?
24.
24? Where do you live, Aaron?
If there is time while en route, you should try to get a sample of your patient's medical history. You're looking for signs and symptoms, allergies, medications, past medical history, the patient's last meal, and events leading up to the incident. This information will be very helpful to the treatment facility and the long-term care of your patient. The remaining time during transport is spent on the ongoing assessment of your patient. It is a repeat of your initial assessment, vital signs, detailed assessment, and an evaluation of your interventions. Stay in close contact with the treatment facility throughout these surveys and report any changes in the patient's condition immediately. Working in a rural environment as an EMS professional is a challenging career. You must adapt your knowledge and skills to a host of varying circumstances. Working efficiently within the golden hour is your patient's best chance of surviving critical injuries. Although you face many obstacles, you, the EMS professional, can win your race against time.